Hi, good day. I'm Dr. Joe Bayer Alonto. This lecture series is intended for Xavier University, JP Rizal School of Medicine third year medicine students, particularly for the surgery module number 4. So, a little bit about myself. So, we'll be discussing orthopedics module, divided it in 3 parts basically. We'll be discussing the review of the musculoskeletal system. Later on, we'll be discussing orthopedic history and physical examination, to be followed by a discussion on the general orthopedics, trauma, and its other subspecialties. So, pretest for this first lecture. So, for this review of the musculoskeletal system, we'll be discussing skeletal muscle, the tendons, joints, ligaments, bursa, the synovial sheath, bone and cartilage, and we'll also be discussing bone healing on a different lecture. For this segment, we'll be discussing skeletal muscle and the tendons. So the skeletal system, it's important for us medical personnel to have a sound knowledge, understanding of basic anatomic terms. And by this we mean there should be some uniformity, both nationally and internationally. So without these terms, one cannot accurately discuss or record the abnormal functions of joints. So we'll be discussing this one. This should be quite familiar with you guys since we've been discussing this, the anatomy, in first year. So when we talk of the skeletal system, we always go back to the anatomic position, and we also need to discuss the median sagittal plane, which divides your body from left to right. This is a vertical plane passing through the center of the body, divided into equal right and left halves. You'll also be discussing it in terms of coronal plane, which is imaginary vertical planes that have right angles to the median plane. We also have your horizontal and transverse planes. And we also need to review the anterior and posterior. And when we discuss in terms of the region of the hand, we have your palmar and dorsal, and in the foot could be referred as plantar and dorsal. We also need to consider the relations in terms of which side, like ipsilateral, meaning of the same side, or contralateral, of the opposite side. So the skeletal system basically is involved in movement. So we have your flexion, extension, your lateral flexion, your abduction, which is moving away from midline, adduction moving towards midline, and a combination of these movements would be your circumduction. Bear in mind that in the hand, the thumb in particular has different planes of movement, what are called differently, like thumb adduction and abduction are of different planes compared with your fingers. Remember that skeletal muscle is what's responsible for moving the skeleton. So, in terms of skeletal muscle, we have your origin and insertion. Basically, your skeletal muscles are also known as voluntary muscles and are composed of your striped muscle fibers. So basically, they have two or more attachments, and origin. Origin is what we term as the one that moves the least, and the one that moves the most is usually called the insertion. But the origin and insertion could vary depending on the position. The fleshy part of the muscle is also referred as belly. The ends of the muscle attach to bones or cartilage. They're called tendons. And occasionally, when there are flat muscles, the fibrous tissue covering it is also called an aponeurosis. And this term should be familiar with you by now, since you're already in third year. So when we talk of skeletal muscle, let's discuss the internal structures. So you have your muscle fibers covered by your epimysium. And I'm sure you're very familiar with this structure. Your muscle fibers, then you have your epimysium covering your perimysium, then in turn covering your fascicles, then connected to the bone via, via your tendon. And I'm sure you still remember this one, the sliding filament theory, where which explains how muscle contracts. And it's also important that fiber arrangement could be used to describe how the shape of the muscle. Like we have your pennate, your bipennate, and your multipennate muscle. So skeletal muscles, in terms of action, can be described as either a prime mover, the antagonist, fixator, synergist, or paradoxical movement. So the prime mover basically is the chief muscle that's responsible for a particular movement. Like for example, when we're extending the knee joint, would be the prime mover would be our quadriceps. The antagonist would basically be the muscle that opposes the action of the prime mover. Kumbaga sa prime mover ang bida, siya yung kontrabida. So in terms of uh, extending the knee, if the quadriceps is your prime mover, your antagonist would be your biceps femoris. In some areas, we have a fixator. Basically, a fixator is one that contracts isometrically to stabilize the origin of the prime mover so it can act efficiently. So kung sa pelikula, sa action movie, the fixator is the sidekick. So for example, when the muscles of the shoulder are contracting, the muscles that attach the shoulder girdle to the trunk, like your pectoralis muscles, they act as fixator to allow your deltoid to act on the shoulder. Synergist, in many locations in the body where the prime mover crosses several joints, it prevents unwanted movements in the intermediate joint, and they contract and also stabilize the intermediate joints. For example, the flexor and extensor muscles of the carpal bones, they contract to fix the wrist joint. This allows long flexor and extensor muscles of the fingers to work. This term also applies particular muscle during a particular movement, and sometimes they act as in a particular movement. They can act as either a prime mover, antagonist, a fixator, or synergist, depending on the movement to be accomplished. To be accomplished. To be accomplished. It's also important to note that skeletal muscle, the nerve supply, usually is a mixed nerve, 60% motor and 40% sensory. So that's first part of our review. So we've discussed skeletal muscle and tendons. We'll be discussing joints. So joints are described as a site where two or more bones that come together whether or not movement occurs between them. And they could be classified according to the tissues that lie between the bones. Could be either be fibrous, cartilaginous, or synovial. So fibrous joints, as seen in this slide, particularly the sutures of the skull, there's very little movement possible, almost no movement at all, because they're connected by fibrous tissue. While cartilaginous joints, particularly seen in this slide, is they can be divided into a primary or a secondary type. They're basically united by a hyaline cartilage, and there's little to no movement at all. A secondary cartilaginous joint is one which is also united by fiber cartilage but connected to a articular surface of bone. So the examples of secondary cartilaginous joints would be your vertebral bodies and the symphysis pubis. So our main concern here in the musculoskeletal system, particularly in orthopedics, is the synovial joints. Basically, the articular surfaces of the joints are covered by hyaline cartilage separated by joint cavity. It's called synovial because there's synovial fluid. The, the synovial joints permit more freedom of movement. The joint is lined by a synovial membrane, which also produces your synovial fluid. And in some joints, particularly big joints, there could be articular disc or fat pads to help lubricate in and help in the movement. So synovial joints, we have different types in terms of movement. You have your plane, you have your hinge, you have your condyloid, you have your ellipsoid, you have your saddle, and you have your ball and socket. So your plane joints are a particular example of these are your sternoclavicular and acromioclavicular joints, where the two ends are almost flat and they slide with one another. An example of a hinge joint is resembles a hinge on a door and permits only flexion and extension, only one plane of movement. So example of these are the elbow and the ankle joints. Pivot joints, where there's a central bony pivot surrounded by a bony ligamentous ring, and the usual movement is rotation, and this could be seen in your atlantoaxial and superior radioulnar joints. Condyloid joints are those with two distinct convex surfaces that articulate with two concave surfaces. So the movements are flexion, extension, abduction, and adduction are possible with some degree of rotation. Examples of these are your metacarpophalangeal joints or the knuckle joints. Ellipsoid joints, there's a convex articular surface that fits into a concave articular surface. But the difference with the condyloid joints is with ellipsoid joints, the rotation is not possible. The example of this would be your wrist joint. Saddle joints. So synovial joint stability is based on the shape, the size, and arrangement of the articular surfaces, as I've already mentioned. It's also based on the ligaments that surround it. The more the ligaments around it, the more stable it is. Usually to supplement uh, the lack of an articular surface. Also, the tone of the muscles around the joint. So if the muscles around the joint are weak, then it's said that these joints are less stable. The capsule ligaments receive an abundant sensory nerve supply around the joint. The sensory nerve supplying a joint also supplies the muscles moving the joint and the skin overlying the insertion of these muscles. This is termed as Hilton's law. So basically, Hilton's law just states that nerve supplying the joint uh, basically it also supplies the skin overlying the muscles around it. So we see here the shape of the articular surface. The shape of the articular surface would dictate the stability of the joint. The ligaments, like in the knee, the ligaments surrounding, like your collateral ligaments as well as your cruciate ligaments, would help in the stability. And in the foot, the pull of your muscles, the tone of your muscles, would help stabilize the joint, particularly your ankle, your subtalar joints, as well as your tarso-metatarsal joints. So we have discussed skeletal muscle, tendons, and joints. We'll move on to ligaments, bursa, and synovial sheath. Ligaments or bursa are cord. Ligaments, particularly, are cord or band of connective tissue uniting two structures. They're basically in association with joints and basically are of two types. You have your dense, those are composed of dense bundles of collagen fibers and usually are unstretchable under normal conditions. The second type of ligaments are basically composed largely of elastic tissues and can regain its original length. An example of a ligament which is quite unstretchable is your iliofemoral ligament of the hip joint and the collateral ligaments of the elbow. A good example of a ligament that is composed largely of elastic tissues would be your ligamentum flavum of the vertebral column and the calcaneonavicular ligament of the foot. A bursa is a lubricating device consists of a closed fibrous sac lined with a delicate smooth membrane. They basically go where tendons rub against bones. It has a protective function. It contains a film of viscous fluids and are found basically where tendons rub against bones, ligaments, or other tendons. An example of this would be your prepatellar bursa. In this drawing, there you can see the here before the patella, well, because when you flex and extend your knee, the patella would tend to rub against your femur. So there's a bursa to prevent uh, bone from rubbing against bone. The synovial sheath is a tubular bursa that surrounds the tendon, and the tendon would evaginate the bursa from one side so that the tendon becomes suspended within the bursa by what we call a mesotendon. So, synovial sheath, they occur where tendons pass under ligaments and retinaculum and through also fibrous tunnels. And in the same way, they act to reduce friction between the tendon and the surrounding structures. We'll proceed with the discussion on bone and cartilage. So bone basically is a living tissue capable of changing structure and result of stresses to which it is subjected. So sometimes we look at this bone as a solid part of our body, but it's important to note that the bone is a living tissue and continually renews itself, and it's even said that you get a new set of skeleton every 8 to 10 years. So it has a protective function. It protects your vital organs from injury, like inside your rib cage, protects your heart and lung. The sternum, the ribs would also protect the thoracic and upper abdominal viscera. In particular, in orthopedics, it serves as a lever, as in the long bones, and is also has an hematologic function as an important storage for calcium as well as bone marrow. And it's important to note that bone, there are two forms. You have your compact bone and your cancellous. So your compact bone basically is what appears as a solid mass, and cancellous bone consists of a branching network of trabeculae. So this trabeculae arranged in such a manner that they resist stresses and strains to which the bone is exposed. I'm sure you're quite familiar with this drawing already. You have your osteon, the basic unit of your skeletal system, then covered with perosteum, then your haversian canals with connected by your Volkmann's canals, and here I already mentioned the trabeculae of spongy bone compared to the outer layer of compact bone. So we can classify bone according to the region, which we could say an axial, which is composed of your skull, the spine, and your rib cage. And when we say appendicular, by the name, you have your shoulder girdle down to your upper limb, your pelvic girdle down to your lower limb. We could also classify bone in terms of shape. So long bones are found in the limbs, the humerus, femur, metacarpals, metatarsals, and phalanges. Even if they don't seem to be that long, they're also classified as long bones. They're called long bones because their length is basically greater than their width, and they have a tubular shaft, the diaphysis, and usually an epiphysis at each end. Short bones, in particular, are found in the hand and foot. You have your scaphoid, your lunate, your talus, and your calcaneus. So basically, the carpal and tarsal bones are classified as short bones. They're usually are roughly described as cuboidal in shape, and they're composed of cancellous bone surrounded by a very thin layer of compact bone, and are covered with perosteum, and the articular surfaces are covered by hyaline cartilage. Flat bones are found in the vault of the skull, particularly your frontal, your parietal bones, and they're composed of thin inner and outer layers of compact bone, the tables separated by a layer of cancellous bone called the diploe. The scapula can also be classified under this flat bone. Sesamoid bones are small nodules of bone that are found in certain tendons where they rub over bony surfaces. So basically, a sesamoid bone, the greater part would be buried in a tendon and the free surface is covered with cartilage. Uh, the largest example of this, largest sesamoid bone in the body is the patella, which is located in the tendon of the quadriceps femoris. Other sesamoid bones we could find are those in the tendons of the flexor pollicis brevis and the flexor hallucis brevis. The basic function of your sesamoid bones is to reduce the friction on the tendon, and it also acts to alter the direction of pull of a tendon. The best example of this, as I mentioned, is the patella. It acts as a, it helps in the lever of your knee when it tries to extend the knee. So structure of bone. basically it has what at birth there's what we call the marrow, which is basically at birth is red and hematopoietic and helps in bone formation. It's all bone surfaces other than the articulating surfaces. Basically, there's covered by a thick layer of fibrous tissue called the periosteum, which has a very abundant vascular supply. And cells within the periosteum are said to be osteogenic, and particularly in the young patients, the young population, it's well united to the bone at sites. Bundles of collagen fibers, known as Sharpie's fibers, they're known to extend from the periosteum into the underlying bone. So the center of bone formation is found in the shaft of the bone. It's referred to as the diaphysis. The plate of cartilage at each end lying between your epiphysis and the diaphysis is where the growth happens. This is called your epiphyseal plate. The metaphysis is the part of the diaphysis that butts into the epiphyseal plate. So, so let's move on. So is developed by two processes. It could be either be membranous or endochondral. So in the first process, the bone is developed directly from a connective tissue, and in the second, there's a cartilaginous model, which is first laid down and later replaced by bone. So some examples we note with membranous or bone development or ossification would be the flat bones of the skull, and most of the long bones in our body, particularly in our limbs, they grow by endochondral ossification. So cartilage is a form of connective tissue in which the cells and fibers are embedded in gel-like matrix, except on the exposed surfaces and joints. The fibrous membrane called the perichondrium covers the cartilage. There are three types. You have your hyaline, your fibrocartilage, and elastic. So for hyaline cartilage, there's a high proportion of amorphous matrix. It has a great resistance to wear and tear, and they cover articular surfaces of nearly all synovial joints. But the but hyaline cartilage is incapable of repair when fractured. Uh, the defect is filled with fibrous tissue. Second type is fibrocartilage, which has many collagen fibers embedded in a small amount of matrix and found in disc within the joints. So particularly your TMJ, your sternoclavicular joint, the knee joint. Fibrocartilage, when once damaged, it repairs itself slowly in a manner similar to fibrous tissue. But the joint discs, particularly, they have a poor blood supply, and they do not repair themselves in damage. So elastic cartilage, the third type, would possess a large number of elastic fibers embedded in matrix, and as the name implies, they're quite flexible and can be found in the auricle of the ear, the external auditory meatus, the epiglottis. Elastic cartilage, if damaged, repairs itself with fibrous tissue. And it's important to note that among these types, hyaline cartilage and fibrocartilage will tend to calcify or even ossify in later life. So it's also important to note the effects of sex, race, and age on structure. As they say, uh, that male and female are equal, but in terms of body changes, the adult male tends to be taller than the adult female, but the adult female tends to have longer legs. The male has bones that are bigger and heavier. The muscles tend to be larger, and he has less subcutaneous fat, which makes his appearance more angular. The adult female tends to be shorter than the adult male and have smaller bones and less bulky muscles. Particularly, she has more subcutaneous fat and fat accumulations in the breast, the buttocks, and thighs, giving a more rounded appearance. The adult female has a wider pelvis than the male. She also has a wider carrying angle at the elbow, which results in a greater lateral deviation of the forearm on the arm. Until the age of approximately 10 years old, the boys and girls grow at about the same rate. And around 12, the boys often start to grow faster than girls, so that most males reach a greater adult height than females. Puberty is between the age and 10 and 14 in girls, and in boys it's usually between 10, 12 and 15. So I'm sure you can recall the body changes that occurs between males and females during puberty. There's also racial differences in terms of skin, hair, and eyes, and the shape and size of the eyes among races. Uh, Africans and Scandinavians tend to be tall, usually having longer legs, whereas Asians tend to be short with shorter legs. This is a particular interest in orthopedics since some of our implants that we use for Caucasian population usually would tend to be larger and not fit for the Asian population. Also to note difference between age in terms of structure of the body. So during late adulthood and old age, many of the bodily functions become less efficient. Our particular concern here is when it comes to bone metabolism. I'm sure you're familiar with the term osteoporosis, the condition osteoporosis. So that's a good example of difference between age. So that's for the first lecture. We discussed skeletal muscle, tendons, joints, ligaments, bursa, synovial sheath, bone, and cartilage. So please answer post test. Okay, thank you.